Hello, it's Dr. Rhonda Johnson. Today is Thursday, December 7th, 2023, and today I'm talking about HIV. Yeah, I know December 1st was World's AIDS Day, and I'm a little late, but in my mind, it's never too late to increase awareness about HIV. Now, everything that I'm sharing comes from Hiv.gov, and it's really basic today. So let's start with what is HIV. HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the cells that helps the body fight off infection. How is HIV spread? Well, it's spread through contact with certain body fluids of a person who's infected with the virus. You get these body fluids from being in contact with blood, semen, rectal fluid, vaginal fluid, and breast milk. Those are the body fluids that can transmit AIDS. And again, HIV. Again, most commonly people get it through unprotected sex or sharing equipment related to injecting drugs. How is HIV not spread? I think this is important too. You don't get it through the air or water. You don't get it through bites from mosquito sticks or other insects. You don't get it through saliva, tears, sweat, feces, or urine that's not mixed with the blood of a person infected with the virus. You don't get it from shaking hands, hugging, sharing toilets, or sitting on a toilet seat, sharing dishes, drinking glasses, silverware, or engaging in closed mouth kissing. You know, that kissing on the cheek that you do with a person who's infected with HIV. You cannot get it from drinking at a water fountain, and most blood is highly screened for HIV in most countries in the world. Now, why is this important? Because if you have HIV and you don't know it and it's left untreated, it can lead to AIDS, which stands for Acquired Immunodeficiency Syndrome. Now, your body cannot get rid of HIV. It can't clear the virus, and there is no effective cure for this disease. And as of today, there's no vaccine. So once you have HIV, you have it for life. Now, there may not be a cure, folks, but there is very effective treatment. HIV can be effectively treated with medicine called antiretroviral therapy, or ART. If taken as prescribed, ART can reduce the amount of the HIV in your blood to a very low level. And if the person's level is very low that a standard lab can't detect it, people can live long and healthy lives, and they won't transmit it to their sexual partners. Now, let's talk a minute about AIDS. AIDS is the late stage of HIV infection. At that point, your immune system is so severely damaged because of the virus. Untreated people with AIDS typically live around 3 years. So how do you know if you have HIV? Folks, the only way to know for sure is to get tested. Now, the CDC recommends that everyone between the ages of 13 and 64 be tested for HIV at least once in their lifetime as a part of routine health care. Now, people should get tested more often if they're engaged in multiple sex with multiple partners, or you're having sex with somebody whose sexual history you don't know. Now, you can also get a test that you can take at home. You can buy it through online retail or at a pharmacy store, and you can test yourself in private. Now, before I leave this topic, I want to talk about PrEP and PEP. PrEP stands for pre-exposure prophylaxis. And if you're HIV negative, it can help you prevent getting HIV. And PEP stands for post-exposure prophylaxis. If you have a high-risk sexual encounter, you mess up, you have an unprotected sex, or you're sharing needles, you want to get this PEP, post-exposure prophylactic medicine, within 72 hours after exposure to be effective. Okay, I know that's the basics. I'm not trying to go into treatment and all of that, but I hope this is helpful, and please go to Hiv.gov for more information. That's my message today. As always, be well, folks, be safe, and take care.